in her case, but the main point is she came to us on mistletoe, and she's going home with treatment that has a good chance of curing her and letting her live her life and being 85 or 90 and seeing her grandchildren and her children grow up. So thank God we were able to spend time with the patient, and thank God she was able to listen and understand and absorb after a year of being on a tangent that was not helping her. So that's the kind of work we do at Radiosurgery New York. We have time to spend with our patients to find the lump that's causing the problem, or to put the patient in a direction that we believe. Ultimately, the patient has to understand and agree, because the patient is the president of the United States of their body. We can only be the advisor. We can only direct. We don't force anybody to do anything. So if you like our work, great. If you don't like our work, and give us a kick in the pants, that's your prerogative. It's your choice. But it's the way we practice, that we return your calls, we spend time with you, we review your reports, and try to interpret for you what's gone on in your case. This is Dr. Lederman from Radiosurgery New York. We're going to hear from our sponsor for just a moment, and then we'll be right back. If you have questions, we are live in the WABC studios. You can call Bruce. We'll pick up the phone, 1-800-848-9222, 1-800-848-9222. Here's the word.
With Dr. Lederman, the best prostate cancer treatment is custom-tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and there's some news. Actually, this is news from Europe. How can we help prevent colon cancer, colorectal cancer? Well, here's a randomized study, which means people were randomly allocated to either doing one thing or another thing, and then they were followed. So what were the things they were doing, and how did it help? Well, in Norway, a study of 100,000 individuals from 50 to 64 years old in this city in Norway were randomly selected to either have sigmoidoscopy. So sigmoidoscopy is not colonoscopy. Sigmoidoscopy is only looking up into your sigmoid colon. So it looks at your anus, your rectum, and your sigmoid. So a relatively short distance in your rear end. And did it prevent cancer? Well, the answer is yes, it did. After 11 years, in the screening group, there were 71 people who died of colorectal cancer. Now, sigmoidoscopy does not look at the whole colon, so it's a simpler test, a cheaper test, an easier test, but it looks where most of the cancers come, not where all of them come. So yes, there were still deaths. After 10 years, in the group that was screened, there were 71 people who died of colorectal cancer. Guess how many in the unscreened? Okay, so the randomization means half were screened, part were screened, and part were unscreened. The part were unscreened, 330 died in the control group. So screening, sigmoidoscopy, reduced colorectal cancer by about 80%, colorectal cancer deaths by about 80%. This was an article that was published in JAMA by a group led by Dr. Holm and all. So again, it's a great study, randomized study, to show that if you have sigmoidoscopy, you can reduce your chance of dying of colorectal cancer by about 80%. Great study. Look at it. Give me a call if you wish, or if you need to be arranged to get checked up. We all should be, me included. That means you included too. We had a woman who came from upstate. She's a 67-year-old woman, and we often talk, and we want to talk to these women who have lumps in their breast, who have just been ignoring it for so long. They're so afraid of workup or pain, and it seems like they'd rather stay home and die than get treatment. No, you don't have to. Please come in like this woman. She heard about our work. She came in, she's 67, she's married with 2 kids. She has a lump in the breast about the size of a golf ball. It's now growing through the skin. The skin is red from the cancer. She came in just a couple days ago. We found this lump in the breast. We found a lump under the armpit in the axilla. So when cancers grow in the breast, they often next spread to the lymph nodes under the armpit, and her lymph nodes were tender and enlarged. She came in, and one day we offered to do everything, which is to stick a little needle into the lump, suck out some cells. The skin is numbed up, so there's no pain. We then did a PET scan. We looked at her whole body, all in one event. So in one event, she came in, she saw me, she had a full physical exam, full history exam, put a needle in the breast lump, found cancer. Yes, it was cancer, and staged her up. And luckily for her, the cancer was confined only to that local area. It was in the breast, under the armpit, and the lymph nodes under the breast. So a woman has muscles in her chest just like men do, the pectoralis muscle. You don't think about it much, but yes, women have pectoralis muscle. Most of our body actually is the same or very similar. Some people want to, I guess Hugh Hefner wants to exaggerate the differences, but actually much of our bodies are similar or have analogous organs in them. So in this woman, she had a lump. She came in because she heard us talking about it, and we could stage her up without pain, without suffering, sticking a needle in under anesthesia, just local anesthesia like you'd get for a tooth. It was done quickly, it was done effectively, it was done accurately, staged up, and now she's starting treatment for the breast cancer, which unfortunately she ignored for years, but fortunately she's now getting treatment. So great for her, and bravo for her, and it's really good news for her. So if you have a lump in your breast or someplace else and you want to know what it is, give us a call. Our office is 212-CHOICES. 212-CHOICES is our office number. 212-246-4237. 212-246-4237. By the way, our office is at 38th Street and Broadway, so it's right on Broadway, next to Macy's in Times Square, just a minute away from each. So we're centrally located. She came in by train. You can take the train, come to Penn Station, Grand Central, Port Authority by the bus stop, PATH train, It's easy to get to us, but it's not only easy. We think it's great. There's also a study that just came out this week that showed that women that are taking NSAIDs, which are non-steroidal anti-inflammatories, can reduce their risk of breast cancer recurrence by taking non-steroidal. So this is a report. It was written up by Joe Cavallo. It was published in the ASCO Post, which is a paper for doctors. And she writes that obesity is associated with worse cancer prognosis and more inflammation. Overweight and obese women who use aspirin have a 52% reduction in breast cancer, and they have a 28-month better time to recurrence. So there's less breast cancer and longer survival in women who are taking non-steroidal anti-inflammatories. This is in women with breast cancer who are overweight. It's a study that was looked at and published just recently in the journal called Cancer Research. So the researchers found the recurrence rate, if you take non-steroidal anti-inflammatories like Advil or ibuprofen or Aleve, was 52% lower than in women who weren't taking these drugs, and they remained disease-free much longer, years longer, just by taking an Advil. So you can see another reason why I tell my patients in general, I love the Advil. And here's a gentleman who's interesting as well. Every patient's interesting, really, because if you spend time with them, you understand that every person has a story, every person has a situation, and we can learn from every patient. This is a 73-year-old black man. He has 2 boys. He had prostate surgery in 1996 at one of the big hospitals in New York. So he's 73, so he had surgery almost 20 years ago. So he must have been 55 years old. Worked for New York City. After surgery, he was left impotent and incontinent, which we talk about all the time. And if you look at our booklet, you will see the impotence and incontinence rate after open surgery is so high. Now, this man, 73, has been wearing a diaper for the last 18 years after surgery, which is sad because it didn't have to be that way. We had data back in 1996. We've been at our program for almost 25 years, and we have data. And for men with prostate cancer, look at the data. You'll have a higher chance of being cancer-free, most probably with us. Just look at the data, look at your category. It's true in most every category. I think it's true in every category. And the likelihood of keeping your urinary life with us is about 99%, compared to about 80% with surgery losing their urinary control. And how do I know this? Well, you can know it too if you call us at that 212 Choices number during the week. We'll mail the booklet to you, but if you open up page 14, you'll see that 97% of men have sexual problems, meaning unable to have erections for intercourse after open surgery or robotic surgery. And who controls the urine? Well, only 20% of men with open surgery and 13% with robotic surgery, meaning 80 to 86% of men lose control of the urine after surgery. And this is a study from Harvard Medical School. So what happened to him is predictable. We could have told him that. Unfortunately, he didn't speak to us. We didn't meet. And worst of all, his cancer is back. After open surgery, the PSA should be 0. His PSA 7. So he has recurrence of the prostate cancer. For 18 years, he's been impotent. For 18 years, he's been leaking urine, wearing a diaper, and now his cancer is back. So there's multiple studies show that we can help him. Multiple studies show that we can improve his survival rate. We can't guarantee it, but there's a good likelihood we can help him. And for those of you who have prostate cancer and who have not been treated, please give us a little time. Let's meet. Let's go over the data before you make a decision, because Think about this man, 18 years wearing a diaper. It could have most likely been